It's time for us to delve into the hearts of our communities, to tell you stories that matters and stories that are also shaping our collective future. So today we are going to be focusing on Chereponi district in the northeast region, where an ongoing power crisis is actually threatening not just lives but also the livelihoods of everyone there. The district hospital is actually on the verge of returning to a cash and carry system, and this is a stark reminder that of some of the challenges that we are facing in our health sector. Jifa, what are your thoughts about this?
Chris, we've been on this show many times, talked about these issues, health, we've talked about bad roads, we've talked about electricity and many others. And I don't see why at this point in time, I mean in 2024, especially in an election year,
Right.
we are still having these issues. Health is very important. Health is world. So if a hospital, a district hospital is facing these issues of power outages, then I don't know, it boggles my mind because they need power to support their emergency units.
Right.
They need power to do all of their day-to-day activities. So if they are out of power, how are they supposed to run a whole institution such as a health facility without power?
Well, I think when we come back, we'll actually have more on this conversation. But now it's time for us to check out an in-depth video of what the situation looks like. And this is a report put together by our correspondent, Mohammed Aminu M. Alabira. So let's check it out. And when we come back, we'll have a discussion about it.
They said that light is life. And for the people of Chereponi district in the northeast region, the past 2 weeks have underscored the importance of electricity. Life in the district has become unbearable without power, severely disrupting daily living. The absence of electricity has paralyzed economic and social activities. By 6 p.m., Chereponi town and the entire district are enveloped in darkness, with all shops and activities coming to a standstill. One of the worst affected places is the Chereponi District Hospital. Without electricity, residents are left vulnerable to mosquito bites, leading to increased illness. Patients flock to the hospital, but the lack of power has made it difficult for hospital staff to provide adequate care. Whilst the hospital has been running on a generator, the cost of fuel is unsustainable. Hospital management has initiated discussions with the Health Insurance Authority to temporarily revert to the cash and carry system until power is restored. Mohammed Aliu Salana, the medical superintendent of the Chereponi district, spoke to ChannelOne about the challenges they are facing.
Almost every blessed day, we have persistent light of at least not less than 12 hours in a day. And for a hospital that totally runs on a software system, without power, you cannot work. The LIMS is what almost every hospital in the entire country survives on. And I don't know the plans that were put in place before the introduction of the software system. Now, the LIMS doesn't make provision for you to save when you are doing your consultation. So along the line, when the light goes off, you are compelled to lose every data you were capturing.
He explained that the hospital is considering returning to the cash and carry system to cover operational costs during this power crisis. He also appealed to the government as well as charitable organizations and individuals for support.
My plan is to meet with the health insurance people to see whether we can revert back to the folder system for the meantime until the problem is solved. In no time, we have students, they are preparing to write a WASI. Without light, anxiety will set in. Possibly some of them will develop BPs. Traders cannot go about meaningful trading. And I am sure we are going to record high number of hypertensives. And if this issue is not addressed, it will consequently impact on other aspects of our lives.
A doctor working in the emergency ward echoed the medical superintendent's sentiment, describing the difficulties they face due to the lack of electricity.
At the stores, because we don't have light, most of the medicine expires. Most of the medicine that need constant cooling or at a certain temperature, we cannot store them. And most of the drugs, we don't even have a fridge for them. So we are forced to always go outside to buy. We are planning to start to stop the national health insurance because the internal guaranteed fund is not enough. It cannot keep up with we cannot buy the fuel again. So we are starting next week to be charging the patients so that we will get money to fuel the generator to be able to take care of them.
Despite these challenges, patients and their relatives praise the hospital staff for their dedication and care. Here are some of the patients and relatives speaking to Channel One News.
Fortunately, I brought my father here. In the night, for instance, if there is no light, how can they work for us to take for those that they are in the hospital here? So we are also need the light so that they can help us.
Right, that was a report by our Northern Regional Correspondent Mohammed Aminu M. Al-Labira right here at Channel One Television as well as City FM. Chris, so we've seen the health sector. So it's not only affecting the health, it's also affecting education as well as the livelihoods of the people in the town, as you rightly mentioned earlier. And I mean, we've seen that of the health, and I don't understand how a hospital is not getting support or how we are able to leave our hospitals in these states. Now, imagine how you feel when you don't even have electricity for a night, or when you run out of prepaid, worst case scenario, and you can't access any vending point in the night and you have to sleep in the darkness till the morning. How frustrating it can be, because you know that, look, I have a full day ahead in the morning, I need to iron, I need to do things and all of that. And for an institution such as a health facility that they are taking care of patients, their equipment depend on electricity to run and all of that, to render services. In the reports, Mohammed mentioned the fact that it's bringing mosquito bites, which is also another thing altogether, because mosquitoes give you malaria. And the other time on Breakfast Daily, we learned that mosquitoes even give you elephantiasis, right? So if these are the issues or the things they are exposed to, then it's very alarming.
Well, I think this is actually an example of the vulnerabilities faced by many rural communities in Ghana. And I like the fact that we're talking about this, because also he said, the hospital director said something about going back to a cash and carry system, which I don't know the system they were using before. But that also means that it might actually impact or actually affect the access of healthcare to the most vulnerable. Depending on how they were paying before. So if they are going to go back to a system that was not beneficial to them, it would definitely affect the vulnerable. But anyway, like you said, it's not just affecting healthcare, but also affecting the educational system. And let's just look at this video on how it affects the educational system, and then we will come back and have a great conversation about this and talk to the right people and know what will happen moving forward.
For over a week, life in Chereponi has been difficult as the entire district remains in darkness. The power outage has affected health services, education, and various economic and domestic activities. Students at Chereponi Senior High School are particularly concerned about how the blackout is disrupting their academic pursuit. Those preparing for their final WASI and semester exams report being unable to study at night and are appealing to authorities to resolve the issue promptly. Several students have shared with Channel One News how the situation is impacting them.
For the lights that we are not having, it's affecting our studies, our learning, everything. Please help us. We are suffering. Even we are in exams time, our seniors are in the YC work, suffering because of light off. When it is time for their oral tests, they don't have lights for learning. Even the exams, how to listen to the chants to pronounce the word, unless they will get generator to support them. And we don't have lack of fuel. If there is no money to buy the fuel, there is there is going to be no fuel for learning. Please, we are suffering.
As of now, we've just done oral. It wasn't easy for us, for us to learn, then we'll come for the oral. We were to practice so that we'll get some tricks on how the words are being mentioned. But due to the light out, it affected us much badly. And the next day, we are having social studies on the coming Monday. If the light don't come, I think this one, it will be very bad.
Teachers discussed how the power outage is affecting their work and joined in the appeal for a quick restoration of electricity.
And for the past 1 week, in fact, to be frank, we are suffering. The teachers, even in the night, you can't even sit down to even plan for anything. Even in the daytime, you may need a light for some other activities. It is not possible. And right now, the most disturbing issue with the light has to do with the final year students.
The district hospital has also been significantly affected by the blackout. Management is relying on fuel-powered generators to keep the hospital operational. In response, the Member of Parliament for Chereponi, Honorable Tahiru Abdul Razak, has provided the hospital with 2 drums of fuel to help power the generators. Amidst the challenges, some local business people have found an opportunity in the crisis by charging mobile phones using generators for a fee. Although this has become a source of income for them, they too are urging quick resolution to the power issue. When ChannelOne reached out to the VRA for comments, they declined to speak, but assured that efforts are being made to address the problem. There has not been lights in the area for the past week, and nobody knows what the challenge has been. The most affected are the students writing their final exams at the senior high level. They say they have no lights to study in the night and can only study during the day. From Chereponi, Mohammed Aminu M. Alabira, reporting for ChannelOne News.
And there you have it. That was a report by our Northern Regional Correspondent, Mohammed Aminu M. Alabira. And we've seen how this doesn't just affect the health and industry, but trickles down to the educational industry. But right now, it's time for us to get into a conversation with our Northern Regional Correspondent, Mohammed M. Alabira. Hi, Mohammed.
Hi.
Hello.
Hi, good morning.
Hello, Mohammed. Can you hear me?
Yeah, I can hear you. Good morning, please.
Good morning. We just saw your report. So from your observations, what is the overall mood in Chereponi, and how are the residents actually coping with this constant blackout?
Thank you so much. Life in Chereponi indeed is very dire. Everything in Chereponi as at now is in the... I don't even know how to describe it. Residents there are living terribly in the district. The whole Chereponi district is affected by the current lives of businesses, health, education, everything is confusing. Water. The main challenge, the other thing is water, access to potable water and even food. Cars bring water from Yenzi, Nalelgu to Chereponi, ice water or pure water, not even ice, pure water to the place. And if it is brought, but you come and see how people are rushing to the car to buy pure water. And then food too. Many people, they told me they now depend on rice because they have no grinding mills to grind their flour and things. So they travel as far as to Yendi, to Nalegu and other places to grind. They depend so much on rice. Rice too is very scarce as at now in Chereponi because the mills that usually grind the rice are all not functional this time. So life in total in Chereponi is bad.
Mohammed, so I'd like to find out from you, how long has this been for, and has there been any communication from the local authorities or the district service from the Electricity Company of Ghana in response to this issue?
Yes, today is about 15 days. That's over 2 weeks today. that the Chereponi district has been sunk into this. Yes, and talking of communication, the Northern Electricity Distribution Company, that is NESCO, 2 days ago visited the district to assure residents that measures are being put in place to resolve it. Yesterday, the team took some residents. There is this concerned youth in Chereponi who are on the necks of authorities to ensure that the right thing is done. So yesterday, the NESCO team actually gave them the opportunity. They took them to site to see what is actually going on, the efforts they are putting in place to restore power. And they are telling them that they should remain patient. Things will be resolved. But as to when this thing will be resolved, one cannot tell for now.
Right. But do you have any idea, especially from the NETCO, what exactly the problem is? Like, have they said this is the problem or that is the problem?
Yes. What they said was that, initially the high tension from Yendi to Chereponi, there were wooden poles, and they are found in the bush. So during the dry season, many of these wood get burned. So they tried to replace it with concrete ones, and they gave it to a contractor. They say it was about 30-something or 40 poles from Yendi to the place. So instead of the problem also is part from the contractor. So instead of doing the right number of poles, he actually did not replace the poles that he removed. But instead of doing 40 or 30, he actually did 20 or something like that. So it means that what he was supposed to do, he hasn't done it. So this time, the NETCO had called back the contractor who was working on the project to come back to site to correct those things. So actually, it's the replacement of the poles, the wooden poles with concrete poles. That is what is causing the problem now, please.
All right.
Right, Mohammed, thank you very much for speaking with us about this. We'll come back to you later, maybe for some updates when the issues have been resolved.
Thank you. Thank you.
So, right, Chris.
This is actually a very critical situation. It will actually be nice to talk to a representative from NETCO, especially to know, okay, what's the timeline?
Timelines, right.
It's important to know the timelines, and you just don't show the people we are working. You have to give them timelines so people can actually plan their lives. And what I found interesting, but funny at the same time, is, the people that are helping people charge their phones, and now they're charging them money to charge their phones.
Yeah. That's a business venture.
Wow.
Because you need your cell phones or your mobile phones to be able to communicate to your loved ones and other people. So if you need it to power them where you don't have electricity, what do you do?
Exactly. And, I was going to say, can't they be kind enough? But, you said something off camera. You were like, but they are using generators.
And the generators don't power themselves, my dear. They have to fuel it and all of that. So. But by the way, Chris, we have to speak to the medical superintendent at Chereponi Hospital in the person of Mohammed Alinu. Good morning, sir.
Good morning.
You're very welcome to Breakfast Daily. How are you doing, by the way?
Thank you. I'm good. How are you?
Very well, thank you. Now, per the report aired right here this morning on Breakfast Daily, we've seen that the power outage is really affecting your operations, day-to-day activities, as well as your operations in the hospital. Could you kindly run us through how dire the situation is?
Okay. So, actually, my name is Mahmoud Ali Salana.
Okay.
I'm the medical superintendent for Chereponi Hospital. Yes, so I've been in Chereponi for the past 1 year, and the situation didn't start today. Almost every blessed day, we're assured of 8 hours of no light. We tried managing with the situation until our only generator at that time broke down. So in the middle of February, calls were made out to various stakeholders, and the MP came to our aid with a new generator. That was powerful than the first one we used. We survived on it for some time now. Almost every day, we need to use about 4 gallons of fuel to run our services. because the hospital is currently living on the software system. I think they migrated from the folder to folderless for almost 3 years now. And without that, you can't render services. So on the 14th of August, the entire district was in total darkness. We tried to use our little resources to keep rendering our services at a facility, hoping that power will be restored soon. And days went into almost weeks. Then we saw the need to call on stakeholders to come to our aid.
Right.
Because without that, we cannot render services. Because it impacts negatively on our OPD attendance. Once a patient comes and then the light is up, our systems will be off and we will not be able to render our services.
Right, right.
So now we are seeing significant decline in our OPD attendance. And consequently, our admission rate. Because of the current situation, management has taken the decision to attend to only emergency cases. That is emergency surgical cases. Because the machines we use are heavy duty. And once we are going to use it to sterilize our instruments for almost every case, we are likely to spend a lot on running our genset.
Right. But can you actually... Okay, sorry, continue.
Yes. Because of the unplanned power outage, we also had a negative effect on some of our laboratory instruments and equipment. Currently, for almost 2 weeks now, our hematology machine is down.
Wow.
And, we are making serious efforts to bring it back to life. And, as it stands now, we are working on getting the experts from Accra to Chereponi to restore it to its capacity. Yes.
Right. So can you actually explain the implications of reverting to cash and carry system for the hospital and also for the community? And also, before you do that, what system was in place for payment? Because the cash and carry is sort of confusing to us.
Yes. So we are actually not reverting to cash and carry. Cash and carry is only for those without insurance.
Right.
So now our engagement is with health insurance to see how we can reverse back to the folder system for the time being. So that without light we can still render services and then we enter it manually into the claim system for payments to be made.
Right. So has there been any support from government?
So far, it hasn't gotten to that level yet. We are just making appeals to various stakeholders. And considering the fact that there has been no assurance from the power suppliers, we intend to take it to the next level. But health insurance was saying when we are writing to them, we should be able to give a time frame within which power will be restored. But contractors on the side have not been able to give us a definite date.
Right.
So as it stands now, we don't have any assurance when power will be restored to Chereponi.
Okay.
And as the only hospital in the district, we are really worried. Without the Chereponi hospital, there's no hospital in the Chereponi district. And it's a facility taking care of about 78 to 90,000 people. And looking at where we are located, quite far away from our district capital with very terrible roads. Sometimes referring cases is a headache to us. And it's really a worrisome situation. So we are hoping that the power will be restored as soon as possible. And if it is going to take time, our alternative measures should be given the listening ear by other organizations or maybe policy makers for us to continue rendering our services.
Right, Mr. Liu, so I was just curious, while we wait for government intervention and interventions from other people, how are you planning of rendering services? Because the hospital must operate nonetheless. So how are you going to be doing that?
Yes. So earlier, the hospital was surviving on the little generations we make from our internally generated funds, and services were ongoing. But like I said, other well-wishers are responding faithfully, and we are committed to knocking on the doors of almost everybody. Now, our intention is to take our plea beyond the borders of Chereponi to almost every well-meaning Ghanaian to support us in whichever way they can. I can tell you for a fact, apart from the pressure we are receiving in powering the generator, it has impacted in other areas of commodity provision. So if care is not taken, the little commodities we have, we will not be able to provide it for continuous and then quality health care. Yes.
All right. Thank you very much. We are grateful that you're able to speak to us and throw more light on this issue. And then we hope that help will come your way as soon as possible.
Yes, thank you too.
All right.
And we hope that the good people of Ghana will listen to our cry. And if we are not getting the power back as soon as possible, they should come to our aid.
Most definitely.
Thank you.
Thank you too. All right, so we've been speaking to Mohamud Aliu Salana, who is the medical superintendent of Chereponi Hospital. Chris,
this is actually heartbreaking, and I want to go back to the issue. I really want to go back to what caused the issue and the fact that somebody was given a job to do and he did a shoddy job. We need to start, you know, calling out people for the shoddy jobs they do. At the end of the day, we are a community or people that just let things slide. But I don't think this should actually be, you know, one of those things that we sweep under the carpet. I understand that Netco ES has called back the person to come and fix it, but is it fair?
Yeah.
Was that what you were asked to do? And as a contractor, obviously, you should have had some sort of expert knowledge. And with your expert knowledge, didn't you think it was going to affect? So it's also an issue of employing the wrong people to do the things.
Yes.
Don't we research? Like, you understand?
And Chris, you know, the medical superintendent mentioned that that is the only hospital in the district. Have we thought about the health implications of that, how the people are going to be affected when this hospital can't even provide the services they are supposed to be providing? They can't do their or run their day-to-day activities. Have we thought about that?
Right.
We really need to put all of these into perspective when we are thinking about the fact that, oh, it's just power outage. They have to deal with it until we are able to restore power. This is the only hospital the people depend on. How are they supposed to survive?
You know what, I pray someone just comes to their aid, because I don't know, like you said, this is what they depend on. I don't know how this is going to turn out, but I just pray it turn out good. But then let us talk to Mr. Fusaini Mohammed, who is the headmaster of Chereponi Senior High, obviously, because we know this doesn't just stop at the hospital, but trickles down to the educational sector too. So earlier on, we saw a student that spoke. So now it's time for us to, you know, speak to the headmaster. Hello, Mr. Mohammed. How are you doing?
I'm fine.
You are welcome to Breakfast Daily. All right. So, Mr. Mohammed, how are the students actually coping with the power outage?
That's because it went off.
Hello, Mr. Mohammed. Can you hear me? Mr. Mohammed? All right, I think he's having an issue with the network, but if you can hear us, or if you're watching us right now, please call us back. We would like to talk to you and know what's going on. Yeah, so Chifa, like I was saying, I mean, before we actually contract someone, you should have known the person's ability.
Right.
There should be a track record.
There should be some background checks to be sure that, I mean, this person is capable for the job before we are able to hand over the contract. And there should be intermittent reports There should be intermittent reports as to what is going on exactly.
Right.
Why are these people out of power? Somebody should be held responsible.
Yes.
Somebody should be accountable for what is going on, because we can't say that, oh, this is the issue and then we are trying to solve it, like you said early on, with no timelines, with no proper communication or whatsoever. So are we supposed to sit and wait until whenever you feel like the problem is going to be solved, it is done?
It is the attitude that we have. Netco came to carry them to show them that they're working, and everybody's quiet about it. Like, no, it's unacceptable. Something has to be done ASAP.